The first case is a case that's very fresh in my mind. This is a 40-year-old lady who has had refractory diarrhea, had seen other gastroenterologists, and had had an extremely extensive workup prior to seeing me, and was deemed as having diarrhea predominant irritable bowel syndrome with refractory watery diarrhea, incapacitating diarrhea, couldn't go to work, and absolutely desperately seeking alternatives. By the time she came to me, she had already been on prednisone as a last ditch, having been refractory to most all other measures for diarrhea predominant irritable bowel syndrome. Because I was cynical about the diagnosis, I put her through the full court press workup, with starting with colonoscopy to rule out microscopic colitis, a celiac panel, upper endoscopic exam, MR enterography, and then every single test you can do for neurohumorally mediated causes of secretory diarrhea, because I thought she had this watery, voluminous diarrhea. We looked at gastrin VIP levels, even did an octreotide scan, 5-hydroxyindolacetic acid, and absolutely no cause determined. She empirically on steroids did make a response, but only 50% reduction in stool frequency, down from 20 stools a day. And actually my nurse practitioner was doing a stool count on this patient. At her peak, she was doing 150 actual bowel movements per week, incapacitating, missing work time, and really refractory. But we did culture stools extensively and looked for every pathogen, every parasite, anything that you could think of as a cause for diarrhea. We even did thyroid testing, anything you can think of as a cause. A careful dietary history, nothing except for this idiopathic diarrhea syndrome. On January 28th of this year, she was placed on EnteraGam while she was on prednisone, 15 milligrams. And over a 3 to 4 week period, the steroids were completely eliminated, simply adding this agent. And since that time, she has been pretty much asymptomatic, with a stool frequency of 1 to 2 bowel movements per day, mushy stools 4 times a week, but nothing interfering with her life, and now back to baseline, back to normal, feeling well. She's currently maintained on BID dosing, or 10 grams, and now is on therapy going on 5 months, and is a happy camper. Nothing else has changed. She's off steroids completely. I still am in a quandary as to her exact diagnosis. I've offered her going to an academic center to seek another opinion, but she's a happy camper, and she's asymptomatic on this therapy with no intolerance.